Okay, the patient is a 27-year-old black male. His vital signs were obtained prior to this exam. His height is 70 inches. His weight is 190, which gives him a BMI of 27.76. His blood pressure was 136/80. Pulse was 86. Temperature was 85. Respiratory rate is 17. And his O2 sat is 98% on room air. Vision was also done in the hallway prior to the exam, and both eyes, his vision is 20/15. In the left eye, he is 20/20, and in the right eye, he is 20/20. Okay. Next, we'll move to assessment of the head. Feel for any bumps or abnormalities. He is normocephalic. Is there any pain anywhere whenever I palpate on your head?
No.
Okay, close your eyes. Can you feel when I touch?
Yes.
Okay, so his sensation is intact on his face. How about, can you clench your teeth for me? Smile big. Wrinkle your forehead. Puff out your cheeks for me. Facial features are symmetrical. We're going to palpate his temporomandibular joint. Open your mouth. No clicks. Okay. I already did the light sensation across his forehead, his scalp, and everything. So next we'll go ahead and move on to his eyes and do an external evaluation of his eyes. His sclera are white. His conjunctiva are pink. He has no drainage or matting. His eyelashes look full and symmetrical. There's no pain or lumps felt at the lacrimal ducts. So next we will move on to the second part of the ocular exam. And I just need you to, just look forward. Good. And now check the other eye. Red reflex is good. We'll check his pupillary response. Just look straight with it. His pupils are 3 millimeters, equal and reactive to light, and accommodation. Okay, I want you to look at the tip of my pen. Cover one eye, and then I want you to focus on the tip of my pen. Let me know if you see anything double or anything like that.
No.
Uncover, and then do the other eye, please. Okay.
No.
All right. Now I want you to follow my pen, the tip of my pen, just with your head. Don't move your eyes. Or move your head. Good. No extraocular movements noted. We'll move on to the ears. The external auricle is pink. There's no lesions or sores. And we'll test his hearing. Tell me when you can't hear that anymore.
Can't hear it.
Now tell me when you can't hear it.
Can't hear it.
Good. I'm going to check one more thing. I'm going to check your bone conduction. Tell me when you can't feel that vibration.
Can't feel it.
Okay. Okay. Next we'll look at his ears with the otoscope.
The tympanic membrane is visible. All of the bony landmarks are there. And light reflex is good.
And we do that on both sides. We'll move on to the nose. Any problems with your breathing or anything like that?
No.
Okay, his nose is symmetrical. No abnormalities in either of his nares. The septum is at midline. Could you do me a favor and plug one nostril and take a breath for me? Plug the other one and take a breath for me. Both nares are patent. Okay. We'll move on to his mouth. His lips are symmetrical as well. There's no sores. There are just a few little shaving bumps noted on his face. Open your mouth for me. He has all of his own natural teeth, minus his wisdom teeth. Okay. And take a look in the back of your throat. First, I'm just gonna look. No sores noted in the mouth. Can you stick out your tongue? He is somewhat tongue-tied, the frenulum in the front. Okay. Stick your tongue out again for me. Okay. No redness or erythema noted in the oropharynx. No drainage noted. You don't have any cough or anything like that?
No.
Okay. I forgot to have you say that. All right. Whenever I press down on your, stick your tongue out, and when I press out, say ah for me. The uvula is midline and rises symmetrically. Okay, so now we're going to move on to the neck. Palpate the thyroid. The thyroid is now non-palpable, but I don't feel any lumps or lesions. Palpate for lymph nodes. Go ahead and keep your head neutral. Yeah. Let me know if anything hurts when I'm doing this. Back here in neck. Okay, and once again, he does have some shaving bumps, but other than that, okay. Could you put your head down towards your chest? Put it back, side to side, each shoulder. Good range of motion of his neck. Can you shrug your shoulders? Okay, let them down. Shrug them again. Good strength in the shoulders. Okay, I'm missing. Next, we will palpate the temporal arteries. There are 2+. We'll listen to see if there are any thrills or bruits. And while we're doing this, we'll go ahead and listen to the carotids. Okay. And then I will palpate the carotids. They are probably about 3 plus, 2 to 3 plus. And what I'm going to do is palpate your carotid while I listen to your apical pulse. Good. No abnormalities there. We'll go ahead and do inspection of his upper extremities. The skin is warm and dry. No sores or lesions. The nail beds are pink. Capillary refill time's about 2 seconds. And we'll do that on both sides. And have you hold your arms up. Okay, move them above your head. All right, thank you. Check your pulses. Radial pulses are 2 plus. Check the brachial pulse. Support your arm right here, and I'm going to feel for the nodes under your horns. No lymphadenopathy. Okay. Now we'll move to his back. His spine is straight. You bend forward for me. No abnormalities there. He does have some cystic acne on his back. So while we're here, I'm going to go ahead and listen to your chest. Turn around towards the camera, please. Thank you. First, we'll listen to your heart sounds. Okay, I'm going to go ahead and listen to your lungs. I need you to take a deep breath for me. Let it go. Just in and out for me. Now listen in the back to your breath sounds. Turn sideways for me. Deep breath. sounds are clear throughout. Okay. While you're sitting up, I'm going to tell me if there's any pain when I do this.
Nope. Nope.
Okay. Go ahead and lay down and I'll listen to your stomach. Vowel sounds are present times 4 quadrants. Now, we're going to palpate his liver borders. That's about 10 centimeters. Tell me if you have any pain or discomfort. I'm going to just feel around on your belly. Okay. No tenderness, no masses, no enlarged organs are felt. No JVD noted whenever he's laying flat. No pulses, heaves, or thrills are noted. You sit up again, babe. Do me a favor, take a deep breath. Chest expansion is equal bilaterally. When I was auscultating, I auscultated his aortic, femoral, and iliac arteries. I didn't hear any bruise. I didn't feel any bruise or thrills, and the percussion tone was resonant. We're going to have him lay back down so that I can palpate his kidneys. No enlargement, no bumps or masses are noted, and I would do that also on both sides. Now I'll check for his femoral pulse and also palpate to see if there are any inguinal hernias, which there are not. Okay, go ahead and button this back off. Hair distribution on his legs is equal bilaterally. I don't see any scars, any sores, or anything like that. We'll check his pulses. Go ahead and put it down. Check his posterior tibial pulse. Or yeah. Dang it. Sorry, we'll check his popliteal pulse. That's 2+. Let me take your shoe off. Okay. We'll check the posterior tibial pulses. Those are 2+. And dorsalis pedis. It's also 2+. Alright, go ahead and sit up and we'll go ahead and test your reflexes. Reflexes are good in both legs. We're going to test his brachioradialis reflex, which is fine. And we do that on both sides. We'll test his brachioradialis reflex. And we do that on both sides. Good. Now we'll test his sensation. Close your eyes and tell me if you feel sharp or dull when I touch.
Sharp. Dull. Sharp. 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 Dull.
Okay. All sensation is intact of the upper extremities. I'm going to do the same thing on your legs. I need you to close your eyes. Tell me what you feel.
Sharp. Dull. Dull. Sharp.
And we'll test the other leg and foot as well.
Sharp. Dull. Dull.
Good. Sensation is intact of the lower extremities. Examination of the cervical spine. There's no bumps or abnormalities. Palpation and examination of the lumbar spine shows no bumps or abnormalities.